So the government can step in and provide public goods. But there is one problem. There is no market for public goods. So there's no price for public goods. So we don't actually know what the optimal level of public good production is. How much should the state spend on policing? How much on national defense? How much on parks? These are not easy questions. One way to think about these is using the tools from classic welfare economics, and we'll work through an example in the next few slides. Basically, what this asks, and what you've read in the Stiglitz book, is how can we achieve an efficient outcome, an optimal level of public good provision? And it's a good way to think about this problem. But of course, as political science and political economy people, we know that that's not how the real world works. Why would the government do us the favor of choosing the optimal level of public good production? What motivates politicians to provide public goods? Perhaps in their districts, or perhaps to their core constituencies, or to swing voters. And if we already had a hard time sort of trusting each other in the prisoner's dilemma problem of cooperation type situation, who stops the state from exploiting us and charging us too much for the protection it provides? This kind of thinking, of course, is the thinking of political economy and public choice. And you will encounter this a lot in your other modules where you talk about sort of how public policy really works. What is the process, the political process that leads to public good production? But it is good to have a theoretical optimal benchmark, and that's the question of optimal public good production. So how does it work? How should we value a public good such as a clean ocean if there is no market price for this? Let's think about a major oil spill. A few years ago, the Deepwater Horizon rig exploded and millions of gallons of oil spilled into the Gulf of Mexico. So there's a lot of environmental damage, there's a lot of damage to the coastal communities, and there's clearly a value to cleaning this up and providing a clean ocean. So how much should we spend on this? And for some of the actors, that's easy. The fishermen in Louisiana or Florida can calculate their lost revenue. So can the hotel managers that can't, open their hotels because the beach is all dirty and clogged up with oil. But how do we value the damage to the people who go swimming in the area, or to the wildlife, to the environment itself? What we can do there is using a process called sort of contingent valuation. And basically the idea is that we can use people's stated preferences, what they answer in surveys, for example, to get at their willingness to pay. The problem of the missing market is basically that we don't know how much people value the clean ocean or value some public good. So we don't have their willingness to pay. And in the market, that solves itself. But without a market, it's really hard to know this. So we can just ask them. That's of course a tricky question. So if you do a survey and say how much money do you put on a clean environment, people are going to say all sorts of things. But it kind of works actually. But what we can do perhaps better is using something called choice modeling or conjoint analysis. So we present choice sets where people choose different things to mimic sort of the trade-off, especially if you think about mimicking the trade-off between sort of obtaining the public good and sort of additional taxes that they may have to pay for the government to do this. That's using stated preferences, using surveys. And this is actually quite widely used. The second sort of mechanism is using revealed preferences. It's the same idea of like getting somehow at people's willingness to pay. So we can observe real behavior. How much do people change their behavior in terms of buying certain things, for example, in response to changes in the price, and try to estimate the sort of true underlying demand curve, if you want, the demand curve of the public good. So we basically use a three-step process. So we somehow get at individual preferences. These can be either stated or revealed preferences for the consumption of the public good in question and other alternative private goods that people would buy with the tax money saved, so to say. So we try to get at this phase trade-off that people face, and that lets us then basically create sort of estimated individual demand curve for the public good, which then in a third step are aggregated all together based on the surveys or based on econometric work, basically are aggregated into sort of a collective demand curve for the public good. And this in turn then lets us, taking into account the cost of the supply of the public good, we can kind of try to mimic the market mechanism here. Look like, well, we add up all these individual demand curves, like this, I guess, and aggregate them all together to the collective demand curve, so the marginal benefit of the public good given a given price. And then we have an estimate of the sort of marginal cost of the public good, which we know from the looking at the capacity of the state to provide the public good, to clean up the ocean. How much does it cost to clean up at different levels, so to say, at different degrees of mitigating the problem? And then we find sort of the efficient level, essentially mimicking the process a market would create. So the Stiglitz book works through this in some detail, of course. But essentially the idea is that the efficient supply of public goods occurs at the point of the intersection of the collective demand curve, so the sum of what all individuals are willing to give up in tax money at the margin to have one more unit of the public good, with the supply curve, so the amount of other goods that people have to give up in order to obtain the public good. And of course, individuals do not buy public goods, but the expenditures on the public goods are associated with higher taxes. So the price for the public goods can be measured by way of a tax price of this public good. And the collective demand curve is the sum of what all individuals are willing to pay in taxes for the public good. And taken together, this collective demand curve and the supply curve give us an efficient level of public good production. And so based, for example, on the survey on sort of stated preferences for cleanup, or the choice sets that people were presented with, and sort of an estimation of the costs associated with it in terms of taxes and in terms of the actual sort of underlying cost of producing the public good, we can then mimic the market process and sort of estimate what the efficient sort of optimal level of public good production is. And like I said, for those of you curious, the Stiglitz book really works through this process in detail. And we call it the efficiency conditions for public goods, or sometimes also called the Samuelson rule, after the famous economist Samuelson, who sort of invented this. What are the problems with this? Well, it's practically actually quite difficult to apply. So it requires some survey work, some econometric work. So it's actually hard to do that. It's a hard problem, but it is used quite widely because there is no alternative mechanism to identify really what the optimal level of public good production is. One of the other problems is that we have to take into account distortionary effects. So, if you charge people extra taxes to pay for public good production, that of course affects other sectors of the economy, other choices that people make. Perhaps they buy less of other goods. So the consequences can be quite hard to predict in some cases. But the most important problem, of course, for us as public policy experts is that this is not a model of the political process. This is not how public policy gets made in most cases. There are really, really neat use cases like the BP oil spill, like Exxon Valdez, like other disasters where this kind of process gets implemented. But that's not generally how, for example, the UK government decides how much to spend on defense, or other countries decide various expenditures of the state or public goods that are being provided. So it is distinctly not a model of the political process. But it is really useful to think about this sort of efficient level of public good production as a benchmark, as a yardstick to compare the the actually achieved sort of level 2, if you want. And it is practically implemented in some cases. So we just thought pretty hard about the optimal provision of public goods. But many of the things the state does, spends money on, many publicly provided goods, are not public goods at all, or not pure public goods. For many publicly provided goods, consumption is to some extent rivalrous or excludable. So rivalrous meaning there's a marginal cost of supplying an additional individual. So for example, if you think about healthcare, treating more people costs more money, or educating more people costs more money, or supplying more water to people costs more money. So these are not public goods. These are goods where there's rivalry in consumption, and it costs the state more to supply the good to more people. Many of these goods are also excludable. So thinking about toll roads or education, we can exclude some people from benefiting from these, or put up barriers to entry, or charge people, for example. Okay. So what's the problem with that? Well, the problem with sort of publicly provided private goods is that if they are supplied freely, in many cases there will be overconsumption. If something is really cheap or free, people maybe will consume more of it than they would if they had to pay the true cost of it. So we have to think a little bit about sort of how do we allocate publicly provided private goods? What are mechanisms to then ration the publicly provided private goods? We will look at 3 mechanisms: user fees, uniform provision, and queuing. So what about user fees? What if we decide to charge people for using the service in question? Thinking, for example, about a park or an expensive new bridge. So we can charge people toll, a fee for crossing the bridge. Or thinking about healthcare, involving people in paying for part of the cost of treatment that they use. Well, the advantage, of course, is that those who actually benefit bear the cost. So we don't have people who don't benefit from the park or the bridge or the healthcare treatment pay for other people's benefit. But there are disadvantages. Basically, there are twofold. So one is that administering the price system adds transaction cost. One of the reasons the NHS is quite efficient in comparison to other healthcare systems is that there's no pricing mechanism, there's no additional bureaucracy to process claims and fees, etc. Or it's very small. Compared to the US system, for example, or the German system for that matter, where there's a big bureaucracy attached to healthcare. The other associated disadvantage, of course, is that it results in underconsumption. If you charge a fee, even if it's a small fee, you will have some people not using the good. And in the case of the park or the toll road, maybe that doesn't seem that dramatic, but in the case of healthcare, that doesn't sound like a good idea, saying we will price out some people out of using healthcare. That doesn't seem right. So user fees have advantages associating cost and benefit, but they also come at a price. So let's look at this example in a bit more detail using the example of a bridge. So let's think about user fees in the case of the bridge. A few years ago, there was an enormous new bridge built in Scotland. And of course, the core question is, if I barely ever travel to Scotland, why would I have to pay with my taxes for this enormous bridge in Scotland? Now that's a fair question. So one of the mechanisms to recover the cost of the bridge is to not finance it from general tax revenue, but instead use user fees to recover the cost of the bridge from the people who actually use it. So some public goods, like this bridge, are excludable to some extent. So it's easy, relatively easy, to put up, a toll booth and a little barrier and say, like, well, you have to pay in order to cross the bridge. Okay, and That's basically the idea. So if we look at this graphically, we can think about sort of the demand for this good, the crossing the bridge, and looking at the number of users. So there are some people who cross this daily. They commute using this crossing, and before that they had to use a ferry or something, or drive very far to cross at a different spot. So for them, those sort of at the extreme end of the graph here on the left, there are some people for whom this is a huge improvement. So they would have been willing to pay quite a high fee in order to cross easily at this position. But then there are other people who are sort of just on the fringe of benefiting from this. So the points on the demand curve, of course, represent sort of individuals' willingness to pay. So how does welfare get maximized? Well, the best way is to let everyone travel and to somehow pay for the bridge using the tax system. Because the total welfare is basically the benefit to consumers, so the yellow triangle, minus the cost of the bridge. And we will see what happens if we introduce a user fee in 1 second. Because what happens if we instead introduce a user fee? Well, a fee is very good because it recovers the cost of the bridge from those who use it most. And for the high demanders, the commuters, this will still be worth it. They of course use the bridge and they are very happy with this new option. But a fee also lowers consumer welfare. Why? Because while we recover the cost, the red shaded area, there is now a deadweight loss. There are people who would have benefited from crossing the bridge, perhaps going on holiday, or people with not a lot of money who would have crossed the bridge and maybe gotten a better job or something like that, but who will not be able to make the journey because the user fee prohibits them from actually traveling. So the user fee has recovered the cost of the bridge, but at the cost of deadweight loss, of waste, of a loss of sort of Pareto efficiency. So we have seen user fees as one mechanism to ration the use of publicly provided private goods. And we saw that there were some problems with those, namely underconsumption. Now, what are alternatives to user fees? Well, the simplest solution, of course, is uniform provision. Everybody gets the same. The state supplies the private good at the same level to everyone. And that's intuitively appealing, of course. And the advantage is that it saves on transaction cost. So everybody gets the same thing. There is a problem, however. Basically, if you think about the healthcare example again, there may be some people for whom the sort of standard level of care is insufficient. So there may be people who would have benefited from additional diagnostics, for example, when their GP tells them that that's not necessary. And they feel that they should get it, but the healthcare system says it's okay, you don't need it. So there's going to be people who underconsume, and they maybe would have, I don't know, found the cancer in this case. What happens if those people have additional resources and they feel strongly about it? Well, they may sort of, those high demanders, if you want, they may supplement public consumption. So they may buy additional healthcare in a private sector. And suddenly, on top of your sort of lean, efficient public sector healthcare system, you have a private sector to help people get the level of care that they need or desire. And this, of course, increases transaction costs. So user fees have problems. Uniform provision, also big problems. What else can we do? Well, we can use queuing. And again, that's something that, thinking about healthcare, is not sort of a hypothetical example. People in this country wait for many weeks or months for medical treatment, even necessary and urgent medical treatment. So What's the advantage? Well, the advantage, of course, on some level, if you think about fairness and inequality, is that people don't get treated just based on having more money. So instead of wealth determining whether you get medical treatment, it is a fair mechanism in the sense that everybody has to wait in order to get, say, a hip replacement. What's the problem? Well, the problem, of course, with queuing, which we have seen in the first week, is that it's just an alternative way to pay for it. You pay for it with time. So it's an alternative basis of allocation that doesn't use money, but uses time to allocate the resources. And time is, of course, a resource that some people may not have to spare. Some people will not be able to wait the extra 12, 18, 20 weeks for the medical treatment. They will either die or deteriorate while they wait for treatment. And you may also end up with the issues we mentioned under uniform provision. So, as an example, my baby daughter has an egg allergy. So, we ask for an appointment with an allergologist, I don't know, an allergy specialist. But on the NHS, that took, I think, nearly 4 or 5 months to actually materialize. In the meantime, we paid a private healthcare company to provide us with an allergy specialist, and we've done the tests and started some desensitization therapy. So you get the same mechanism, that same problem that you saw under uniform provision, also with the queuing situation. So some people will then find additional sort of private sector solution, which again sort of reduces the overall efficiency of the process. So an important takeaway point for these different allocation mechanisms, basically, in the case of publicly provided goods, publicly provided private goods, is that just because one allocation mechanism is bad or unfathomable, for example, the market, that doesn't mean that the others are automatically better. So it's important to consider the consequences of the different allocation mechanisms. And the healthcare examples have been really illustrative here. Healthcare, of course, is really problematic in this respect. But you will see that in week 5, when we talk about information asymmetry, we will basically see that for healthcare, public provision is the superior option. That's a strong statement for someone who always hedges his bets here, of course, a little bit. So how do we know? Well, because these are essentially empirical questions. So knowing which allocation mechanisms are more efficient is an empirical question. We can look at the overall cost of the bureaucracy associated with the healthcare sector, for example. So we can calculate the costs and benefits for different healthcare systems, different delivery mechanisms, if you want. And the glaring example of failure here, of course, is the US, where we have a system with enormous costs and quite low benefits. And you have the UK system, where you have very high efficiency, very little waste in terms of additional bureaucracy, although the provision level in terms of the benefits is actually much less than most European counterparts. But the important takeaway point here is that just because one allocation mechanism isn't good doesn't mean that the others are. So you have to think about the costs and benefits of all the alternatives. And it is, in many cases, an empirical question. Just because economic theory tells you a market-based mechanism for something is good, or maybe a public option for something is good, doesn't mean that that's necessarily the case. You have to bring data. These are empirical questions, and using data, we can answer the question of which type of healthcare system is more efficient. And it is not always the outcome that people expect.